Hi, Sister Kufre. Good morning.
Good morning.
How are you
And
doing?
you? I'm fine.
Okay, I'm very, very happy to have you today and
Same here.
teach one another meeting. Please let me share the screen immediately. Okay, I believe you know some signs and symptoms of digestive system disorder and disorder. Without me saying it, at least you do have a stomach ache, you have diarrhea sometimes.
Sometimes throwing up, I feel like vomiting.
Yes, vomiting, nauseous and vomiting. Those are the symptoms of digestive system disease and disorder. So I'm sharing the screen now so that we can you see the screen?
Yeah, sure.
Okay. So now, but I have three particular digestive system disorder I want us to talk about. The first one is gastritis. Okay.
Okay.
This is gastritis, okay? It's a
Yeah.
general term for a group of conditions with one thing in common, that is inflammation of the lining of the stomach, otherwise called mucosa. See, it's a,
Mucosa.
yeah, see, it's a gastric mucosa.
Okay.
Okay, so this particular inflammation can cause stomach pain, indigestion, bloating, and nausea. You can see the signs and symptoms here: indigestion, cramping, belching, vomiting, epigastric pain in the region of the abdomen, which is sometimes we normally have all these signs and symptoms. We will normally have this particular gastritis. Then we will, run to the chemist and get one or two medication and take. So, Sister Kufre, please, I would like you to take the treatment plan that is written here.
Okay, the treatment, that is symptoms relieved by eliminating any known irrit irritants such as NSAIDs or alcohol.
Yeah.
Chronic gastritis causing by H.
Mm.
H. pylori infection is treated by eliminating the bacteria, PPs, antacid,
And
antibiotics.
okay, but generally,
Anti
I like, if you know that before now, that whenever we have like stomach ache like this, momsy sometimes will give us paracetamol or antacid. I know I'm already
yeah,
aware
antacid.
of this one.
I
Yes,
could
antacid.
remember antacid. Yep.
Yes, if she doesn't give us paracetamol, she will give us antacid. Then
Sure.
I believe you know the meaning of this particular this thing.
NSAID.
Yes, non-steroidal anti-inflammatory drugs.
Yep.
Okay. So do you have any other contribution concerning this particular gastritis? Because I know it is very, very common, even in a child. A child can complain that
Yeah.
he or she is having stomach ache, or maybe the child is belching, or maybe casting out. You should be able to know that it's gastritis that is disturbing. Sometimes you give them enough water can help, or antacid, or any antibiotics to.
Yeah, that is what I wanted to say because if I have stomach ache, I don't want to know what's the problem. What I want to do, especially if I batch foul batch, and when you batch and it
Yeah.
come out smelling.
Yes.
Okay, I won't be feeling fine. What I will look for is that I will look for water. I'll make sure that I drank
Enough
enough water.
water. Very
And when I take that water, everything will be
good.
fine.
Yes.
So I think for me, water is always good for me.
Yes. Even me say, if I have any stomach indigestion or belching or any bloating, the whole of that day I'll go with water. The water will help me So we move to the second disease, which is peptic ulcer. That one is very, very common too. You can see this thing, the gastritis, how it affects the stomach. You can see it.
Yeah.
You can see it. All these are disease and disorder that normally makes us uncomfortable. So the second one is peptic ulcer. This is a
Okay.
stone that develop on the lining of the esophagus or stomach or small intestine. Okay. Ulcers occur when stomach acid damage the lining of the digestive tract. Common cause of this
Yeah.
particular peptic ulcer is bacteria, anti-inflammatory pain relievers like aspirin. You know about that?
Yeah.
Aspirin or the other one, how do they call it? That particular pain relief, I've forgotten it. That particular
Pain relief.
yeah, it's pain relief, like how do they call it?
Ibuprofen.
Ibuprofen. Thank you very much. Ibuprofen
Okay.
and aspirin, they can cause peptic ulcer. Okay,
Okay.
you can see how it affects. This is it. Gastric ulcer. This is
Wow.
esophageal ulcer. This one affects the esophagus. This one is the small
Yeah.
intestine. You see how it affects this small thing now. Like if this thing wants to, pains you, hey, that day you will not be able to go out. Because I have somebody here who is having um this particular
Illness.
illness. Yeah. Like if this thing starts, he's a grown-up man, a family man for that matter, he will not go to work. You will just see him, rolling on the bed, like sometimes I feel for
Like, when I saw this, there is something that keep on running in my mind, because here a lot of people, when they say you have ulcer, either peptic ulcer or acute ulcer, they will kind of
it.
like, okay, you have not eaten well, you have been starving yourself. But
Thank you.
looking at the description here, it doesn't have anything to do with
With
starving.
hunger, yes, starving, yes. This thing is caused by bacteria. It's not caused by
Okay.
hunger or starving. Okay.
Yeah, they may mention here etiology. They said
Yes, yes.
major risk factor
Mm.
per
H. pylori.
palosis, use of enzyme,
Yes.
alcohol,
Uh-huh.
smoking,
Okay.
pathological hypersecretion disorder.
You
Now,
see?
these are the things that cause this thing.
Yes.
So I don't feel there are maybe food, staffing, or other things are contributed. I think these are the risk factor we should look out for when we talk
Yes.
about peptic ulcer.
Yes, 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 yes. Thank you very much for that contribution. You can see the signs and symptoms of this particular illness: persistent heartburn and indigestion, nagging stomach pain, IG bleeding, hematochezia, nausea, vomiting, and weight loss. Then gastric, it just pain worsens after eating. Weight loss, you lose weight. Exactly.
Yeah.
So let's move to the treatment plan. Okay, the treatment plan so it goes with taking of antibiotics to treat H. pylori, amoxicillin, and clarithromycin, and proton pump inhibitor. So these are the treatment you give to a peptic ulcer patient. Okay, but
Yeah.
if the symptom persists, like the person I'm talking about, the man I told you about, I've been advising him to go to the hospital so that they can give him a proper medication, because normally he doesn't go to the hospital, just taking all these herbs of the thing. That's what he believes in. Whenever that thing
And
starts,
over the
a
counter.
bottle of one, I don't even know the mixture, but you will see this very big ever bottle of a mixture of herbs. You will be taking it,
That is,
but
that's what we
you will
call
still be in pain.
acupuncture.
Okay, you will still
That's
be in
acupuncture
pains
treatment.
until that
Yeah.
thing decides to, subside. That's where he will be going out for his normal activity. But normally, I don't think that thing helps, because I didn't mean that thing helps. The first day you take it, it will supposed to subside the pains, and the following day you can go about your day. You understand? But this thing does not help,
Yes.
because whenever you are in pain, then you take a particular drugs or herbs, and the pain still persists till the following or 3 to 4 days. It doesn't work. So the only advice I give
Yeah.
to visit the hospital, so that they can run a test and know the kind of medication they give to him. But to him, I don't know whether it's a money problem or not. He doesn't want to. So sometimes it's very, very good to look out to one another and know what uh um what we are suffering from, and how we can help each other overcome this particular illness. So, Sister Godfrey, do you have any
So,
other thing to say, to add?
yeah, I was trying to look at the prevention because
Okay.
they say we should avoid
Exacerbating
exa
substances.
exacerbating substances, and those exacerbating substances
That's
should
like
be
smoking.
alcohol,
Yeah, smoking alcohol. Yeah.
smoking, something, inhaling,
Yeah.
anything that you know will affect your um esophagus or anything. In short, your body,
Yes,
you should do
well,
what you should
yeah.
not even go there.
Okay.
And I'm also thinking because there are a lot of people who don't smoke, who don't drink alcohol, who
Those
don't
ones,
live.
those people that does not smoke and does not take alcohol, but they have this particular peptic ulcer, they are people
Yes.
that maybe they have abused aspirin or this NSAID. That's
Okay.
something like ibuprofen. Some of these drugs, they are not used to our system, but we will
Yes.
not listen to our body system. We will continue taking them until
Yeah.
it damages something in our body. That is one of the problems we have.
Yes.
Okay. Um, is that okay for peptic ulcer? Are we okay? Or do you still have anything to say?
Yeah, we're okay.
Okay. So we move to the last case study for today. The last disease we are going to discuss. It is called hemorrhoids. I believe you know about it, otherwise known as pile.
Yeah.
Okay.
That one is very common
Very,
here.
very common. It's a very common disease that is affecting a lot of people, especially pregnant women. Here it is. Okay. So
Hemorrhoid.
yes, hemorrhoid is a kind of a swollen and inflamed veins in the rectum and anus that causes discomfort and bleeding. Okay, this thing is very, very painful. People that are suffering from this disease, you notice the way they walk, and even if they want to sit down, you see they will be struggling to sit down because of the pains, and it needs immediate treatment to avoid further this thing, further damages or anything that will cause another, that would lead to another serious illness. So you can see
Yeah.
this, the etiology says straining at stool, chronic constipation or diarrhea, prolonged sitting, pregnancy, anal intercourse, anorectal infections. Okay, so these are the cause of hemorrhoids. Okay, and it's very, very important for us as humans to look out for all these things. Okay, like I said earlier, I didn't even know that pregnancy can even cause this particular hemorrhoid. Wow, I didn't know. I just learned of this now. Okay, so the signs and symptoms: the erectile bleeding, peritus vac discomfort, and hemorrhoid will be protrude from the anus. Yeah, this is very, very bad illness. Okay, don't know if you have anything to say.
Yeah, because here they will like they especially these fowl people when they want to cure it, what they do is that they will some people cut it because they say the thing will come out as tiny like this from your anus. And some people treat it native, use native way to treat it.
Yes.
Some people have to go to the hospital, and we know it's an infection. It come out of your body from one thing or the other.
Yeah.
So, but some people like treating it natively. Okay,
Yeah.
they use acupuncture in treating the illness.
Yes. Okay.
So,
So I want to ask, does it affect only women, or it affects both male and female?
yeah, sure. The person I saw, like two people I've seen treating this are male, like elderly people, like I'm 45, 50, I've seen treating this illness. So I didn't even see women here.
Okay.
And when you are talking about a woman, yeah, they made mention of pregnancy. It should involve a woman.
Yeah.
But here I've seen like two male treating this. So
Okay.
honestly, I might feel that it affects men more than women.
Yeah. And before this kind of thing really affects women, maybe you carry heavy stuff, like for women, oh, carrying of
Yeah.
heavy stuff, maybe heavy wood or rubber water. This can cause somebody to have
That is abusing yourself.
self,
Work
yeah,
like
to overwork
wasting
yourself.
abuse of yourself in work or other things.
Okay. Thank you so much. So the treatment plan says high roughage diets and using stool softeners, over the counter suppositories
Suppositories.
and creams can calm inflammation. Okay. So you see the prevention that they have, avoiding trending at stool and adherence to a proper diet and exercise regimen. Wow.
Yeah.
Like when I went through this particular hemorrhoid, I really wanted to learn a lot because I've come across two people that have this particular illness. I was like, is it that this thing is it caused by their body system, or is there a kind of infection or a communicable disease? Because the people I'm talking about, there's how you see somebody like you don't know they have illness.
And you feel that you shouldn't be having such
Yes,
illness.
yes, it shouldn't be them, but they have this kind of illness. Like sometimes it got me thinking. Sometimes I used to think, maybe is it the food they eat? Is it the too much taking of sugar that can cause this? No, it got me thinking until I saw this in the digestive disorder. I wanted to, like, I really needed to know more about this particular disease. Like the one I'm talking about was a mother of three, mother of three that have this particular illness, emerald. It was painful, She went to the hospital.
Yeah, yeah. Sometimes, if I tell you a medical practitioner, you know some of the causes because they will be able to open up and tell you. Sometimes it might be that they are straining at tools. They don't sit well when they want to pull. They don't. They force themselves and their muscle contract and it
Yeah,
affects it
yeah.
and causes. Or sometimes it might be a chronic constipation or
Okay.
diarrhea, the food cannot digest well, it causes well.
Yes.
Sometimes prolonged sitting, they sit
Yes.
for a particular long of time. Like for instance, those people who sew clothes, they hardly stand, they can sit from morning till night to sew, and before you know it. And another thing I understand about this, sometimes it's anal intercourse. That is
Yes.
very bad.
Yeah, very
It's
bad.
very, very bad. It causes infection, it causes a lot of things. So one thing I normally feel is that people's body are very different.
Very, very different.
People's body are very different. There are people that go through this thing, they don't have hemorrhoid,
Yeah.
okay? But there are people who don't go through this, but they still have hemorrhoid. So people's body are very delicate. When you know that you have a delicate body system or a delicate body, you need to take good care of it. You know that any mistake, you get infection. There are people that if they live in a place that is dirty, they will get all type of infection. There
Yeah.
are people that if they live in that place, they will stay there for a quite number of time. They are still okay. They are still healthy. If they go for tests, they will tell them that, oh, you are fine. You understand? So people's body this system. If you know your body system, try and live, have a personal hygienic way of life
Yeah.
where everything you do is fine, tidy up, and clean. Because you know that any mistake, you are sick. Okay.
Okay.
So I think a lot of people don't understand this.
Yeah. Thank you so much. I really love the way you understand and contribute on this particular illness. I love learning, and I believe you do too, especially
Sure.
this particular course I'm doing. I really love it a lot. I've learned a lot, especially this
Yeah.
particular disease system.
Let me share an experience with you. There was one time you taught me about scabies.
Yeah, yeah,
Okay. And I discovered that I had a friend who has something related to that. That she has been having this itching. She has some boils, and that itching are in some part, like the hand, the downside of the hand, like this.
yeah.
The bum bum. She'll be scratching her bum bum, like some warm places. I was like, after the class, I was like, this might be KB, so. So I went to her, I tell her that she just clean everything in her house. Like after that, I will give her a prescription of drugs. She will go and buy. I'm telling you the real truth. Now she's free.
Yeah,
Know
yeah,
this.
yeah, yeah.
She's. I was kind of like, oh, so now I can prescribe drugs.
Sure.
So now she's free. So I really learned a lot here.
Serious. Even me, I do learn a lot. Now, even if I just walk on the road and I see somebody with maybe one illness or the other, maybe on the skin, or like the one I told you about, the Koita. I see
Yeah,
the woman, like I was just looking at her, say, God, thank you. But at least I have a little knowledge about what this woman is suffering from. So thank
yeah,
you so much for sparing your time to study with me. I really appreciate.
yeah.
Thank you so much,
You're
and I'm
welcome.
going to see you again next week. We are about closing. I think we have like 2 weeks left, so thank you so much.
You're welcome.
Thank
Welcome.
you. Bye.
Sure. Bye.